Good morning, everyone. It's Angela with Strong Meridian again, and it's great to see you. Today, I thought I would talk about weight loss. And I want to ask you if you know someone taking a weight loss medication, one of those GLP-1 agonists, or maybe you're struggling to lose weight and you're thinking about getting on the medication. One, if you're thinking about it, that's great. Do your homework. Two, if you're on these medications, do you really know what you're taking? Do you know the side effects? I mean, oftentimes we just talk about, well, you get weight loss, you get lower blood sugar, it reduces your risk of cardiovascular disease. Those are all the good things. But have you actually been truly informed what the drug does to and for your body? What could you really experience? What did other people experience when they were taking the drug? Or what did the animal studies show? Were you informed about that? So today I want to inform you about that. I want to take some time and tell you about these drugs. White label. So when you get your medication, this is what should be in the box. And to tell you the truth, this took me longer than it should have to be able to find online. I went to a couple of the popular name brand GLP-1 medications and I couldn't readily find it on their site. I found the positive clinical studies, but I want more information than that. I want to know everything. So I actually had to search. So if you're looking for Ozempic or Mounjaro, whatever drug you're looking for, put in that specific brand and then type in white label. And that should come up with one of your first searches. This one just happens to be Mounjaro. And I'm not calling them out specifically for any one reason. It was just on my search list. And this is their very first warning. So it increases the risk of thyroid C cell tumors. Animal studies, both the male and female rats were given the drug, and this resulted in tumor growth of the thyroid. Now, to be fair, we don't know whether the Mounjaro actually caused the thyroid C cell tumors, or we also don't know if the Mounjaro caused the thyroid cancer, but it did happen. In humans so far reported, it hasn't been determined if the drug would also cause these tumors in us. Now, if you have history of thyroid tumors or thyroid cancer, then they don't want you to take the drug. So that's fair. Okay, so then I just scroll down a little bit and I'm going to look at warnings and precautions. So I want to see what this medication is doing for me and to me. So it can increase my risk of thyroid C cell tumors, which can and cannot be cancerous. And if I scroll down a little bit, it can increase my risk of developing pancreatitis. So now, pancreatitis is a swollen pancreas, and in studies, it has been observed in patients to be fatal or non-fatal. So that means you can recover from it or it could kill you. Scrolling down a little bit more, the medications can give you hypoglycemia, so low blood sugar. And that really is the goal, to lower the blood sugar. Of course, we want to be concerned about going too low, so we don't want to be dizzy, get anxious, lightheaded, anything like that. But it is the goal of the medication is to reduce blood sugar. The next reaction could be hypersensitivity. So hypersensitivity we see can result in anaphylaxis or angioedema. So anaphylaxis, so remember anaphylactic shock. Hypersensitivity reactions have been reported with some of these medications. And that can be, here, the urticaria, that's a fancy word for hives. Very dry, flaky skin can be very painful. I tend to tell people, If you're having a skin reaction, then that same reaction is going on inside the body. We just can't see it because if you think about it, your intestines are just a big tube. They are open to the air and to the outside world, and therefore the skin outside on your body is a reflection of the skin inside your body on your GI tract. So you could get hives, you can get eczema, you can go into anaphylactic shock. Acute kidney injury. So we had first, it's going after the thyroid potentially, and then the pancreas, and now we have a kidney that it's going after. And now acute kidney injury, they could be fatal. They may not be. It could just be because of dehydration. But if you happen to have any underlying renal disease because you have type 2 diabetes, that could certainly be something that triggers this. And if you look at the next one, severe gastrointestinal disease, so GI, it attacks the GI tract. When you take a medication or an herb, though, we want the herbs to sometimes do this for us. We tend to not like medications that make us have diarrhea or give us constipation or inflame the stomach so it hurts to eat. We have this medication really affecting a lot of different areas in the body. So if you're diabetic and you're taking this medication, the next warning could be for your diabetic retinopathy. So that's your eyesight. And with diabetes, especially advanced diabetes, it will deteriorate your eyesight. And you will start to get black spotches in your vision, so you really can't see straight forward on very well. And here, this medication, the Mounjaro, it's actually been associated with temporarily worsening the diabetic retinopathy. So I hope it is just a temporary thing, and that the eyesight returns back to your regular retinopathy. Over time, the white label is not going to say how much time a person would potentially need to recover their eyesight. Acute gallbladder disease. Now, we have a gallbladder for a reason, and it's really important. It actually releases bile when we eat, and that bile then emulsifies our fat and breaks it down really well. And then our pancreatic enzymes come along, and that breaks that fat up even more, so then we can absorb it. When your gallbladder is inflamed, then it's not working properly, and you can actually get pain. So I don't know, I hope your doctor or pharmacist who wrote the prescription and then filled for the prescription told you how to identify gallbladder issues. And if not, that's what I'm here for. So your gallbladder, I'm going to stand up. Your gallbladder is right here. So this is your right side, and your gallbladder kind of sits a little bit under the ribs. And you can get pain here. Mostly, though, you're going to get pain back here. So this is under my shoulder blade, below the shoulder blade. And you can get liver and gallbladder pain there. And it's like a referred pain because the gallbladder is located in the front, but the pain comes in the back. We can really just get symptoms of heartburn, maybe nausea, and those can come with or without a meal. And sometimes you have gallbladder problems and you don't really notice, so it doesn't come with symptoms. It's a surprise, you have gallbladder problems. But usually the inflammation, the gallbladder is going to push on the liver, and that would cause more pain. So this medication can cause the gallbladder to become more inflamed, potentially maybe get some gallstones issue in there, or if you have gallstones, they can be certainly more irritated during this time frame. And then that gallbladder pushing on the liver can cause more pain. Let's see what else these medications do for and to us. Okay, so when they went to trials with the medication. These were some of the adverse reactions they saw. So these are the small clinical studies. These could be human studies. These could be mouse studies. But we saw the risk of thyroid tumors. We have pancreatitis, low blood sugar, hypersensitivities. We had, the eczema, the hives, acute kidney injury, potentially just from dehydration. So if, again, the adverse reaction is right up here in your gastrointestinal area, and it's causing you to have diarrhea and vomiting, that can give you dehydration, and that'll affect the kidneys. And then gallbladder disease. And usually, conventional medicine, then they just take out the gallbladder. Okay, here's another interesting one. So a heart rate increase. So those treated with Mounjaro resulted in a mean increase of heart rate from 2 to 4. So that's a double beats per minute. And here, kind of breaking this down for you. So if they were given 5, 10, 15 milligrams of Mounjaro, then we have the percent of subjects where they received that side effect of the increased heart rate. Okay, now I don't believe that there's enough information and more clinical studies to okay this in pregnancy. And hopefully no one's doing this while you're pregnant, because you don't want to lose weight when you're pregnant. But they did do a pregnant rat study, and they administered the Mounjaro during periods of organ growth, and we had fetal growth reductions, fetal abnormalities occur. And they're not overly specific here on exactly what happened. But fetal abnormalities, that can be a loss of a limb, a half a limb. I know other studies with other medications, you're born without a rib, fetal growth reduction. So that's size. So the infant size would probably be less, maybe the birth weight as well. So definitely something you don't want while you're pregnant. Yet here it seems that they're doing the studies on pregnant rats because we don't want poorly controlled diabetes in pregnancy, because that does increase the risk of diabetic ketoacidosis, preeclampsia, which is very severe high blood pressure in the woman, spontaneous abortions, delivery complications. It also, if you're a pregnant mom and you have gestational diabetes, that can increase your child's likelihood of getting diabetes themselves. So we definitely don't want high blood sugar when we're pregnant. But it seems to me here that they're doing the animal studies maybe potentially to give to diabetic pregnant women in the future, and what would happen to the baby potentially if we did that. So what they did, rat studies, we have some rabbit studies. It looks like gastrointestinal system resulting in maternal mortality, so the mom died. We had the abortion of the fetuses in the rabbit studies, reduced fetal weight associated with decreased maternal food consumption. Yes, because the medications basically make you feel terrible, so you don't eat, and therefore the mom would not be wanting to eat, but then you would also not be bringing as many nutrients for the baby as well. And following the baby rats, the baby pups, we have significantly lower mean body weight of the infant as well. And that's not necessarily a good thing either. So we have renal impairment. This is if you already have some type of renal disease, they're not going to adjust the dose for you. Liver, if your liver isn't functioning very well, they're not going to adjust the dose. And then we just go into how it works by increasing insulin sensitivity and delaying gastric emptying. Okay, So you see some of the side effects now that these GLP-1 medications offer a person. And really, I'm here to let you know about that. I've dealt with a fair number of people taking these medications that they feel it's their last resort. But then I also ask, well, have you tried losing weight through functional medicine? And they say no. So they haven't tried everything. You haven't tried everything if you haven't tried losing weight through functional medicine and being an active participant in your care and having realistic goals when it comes to your weight loss. Weight just does not magically fall off. Now, what the white paper didn't show was some of the other things that people experience while they're on these medications. So, pure anecdotal, when you talk to people or you talk to their doctors, you're starting to see people who are taking the GLP-1 drugs and they're not healing. Their wounds aren't healing. Their skin looks sallowy and gray. Sometimes I've seen them even have a little bit of blue tinge to it. I have seen people, even just on the internet, talk about increase in suicidal thoughts just from having these medications on board. So it's something to consider. You have to consider everything. Have you really tried losing weight through a functional medicine practitioner? Have you been really active in your care and spent a lot of time with yourself? And some of those people, they'll be yes. Many of them will be no. You have to set realistic expectations. And if you're turning to a medication, you deserve to know exactly what you're getting into. So if your doctor hasn't told you about the nausea, the diarrhea, the constipation, potentially getting thyroid tumors, thyroid cancer, pancreatitis, kidney disease, liver injuries, it's time to go back to your doctor and be truly informed about what you're taking, or see your pharmacist. Sit down with your pharmacist. Sometimes they have more time than the doctor. And we go, hey, what am I really taking? What do I need to watch out for? Now, for those of you who want to stop the medication or take weight loss in a different direction, that's where Strong Meridian can come in for you. I am trained dietitian, I use functional medicine, and I love to help people walk through the different steps that they need to take on their health journey. If you have questions on how we can help you lose weight, feel better, and get your energy back, reach out today with questions. Thanks for listening. And share this with someone who you think may benefit.